Hello, my name is Charlisa Brady, and this is Randy Appleman. I'm a student here at Maryville University, and I'm doing the final head-to-toe assessment. She's over the age 18 and has agreed to be here today. Um, Before coming in, I had her empty her bladder. I also do have her in a gown, and we took a set of vital signs here. Her temperature is 98.6, blood pressure is 120 over 79, heart rate is 68. Respiratory rate is 16. Oxygen saturation is 100% on room air. Her height, she is 5'5", and her weight is 118 pounds. Prior to coming in, the triage nurse also did a Snellen on her to check her visual acuity, and she was found to have 20/20 in both her left and her right and both of her eyes. So first we're going to wash our hands and do some hand sanitizing here. Put on some gloves and we're going to check her head and her face. So looking right now at her, I can tell that her skin is all one color. I don't see any scarring of her face or anything like that. We're going to go ahead and palpate her head, see if there's any crepitus or any tenderness noted, anything. No. And looking at her hair here, it is not coarse, and there's no alopecia there. It's evenly distributed. Looking at her face, all of her facial structures are symmetrical bilaterally. Her eyes, her nose is midline there, and there's no deviation noted. We're going to go ahead and start with a few cranial nerves, run through all the cranial nerves actually. We're going to start with number 1, which I'm going to have her close her eyes and see if she can smell. I'm going to put something in front of your nose and tell me what you can smell, okay?
Alcohol.
That is correct. And then next we're going to do cranial nerve number 2, which is the optic. So we're going to see if her eyes are equal reactive to light. And then that was reactive. And that was reactive. And I also noted that her sclera was white there, and there's no redness noted. Next, we're going to do cranial nerves number 3, 4, and 6. That's going to be the ocular, the trochlear, and the abducens, and we'll be checking that by doing the 6 cardinal fields of gaze. So if you will, just follow my finger through the movements here. Okay. Next is going to be cranial nerve number 5, which is trigeminal, so I want to check her sensations. So I'm going to have you close your eyes and tell me if you can feel it bilaterally.
Yes. Yes. Yes.
Okay. Next is cranial nerve number 7, which is going to be your expressions. So I'm going to have you smile real big, frown, puff out your cheeks, close your eyes real tight, open them real wide. We're also going to check for TMJ here. So go ahead and open and close. Thank you. And cranial nerve 8 is the next one. It's acoustic. She's been able to converse with me and hasn't had me repeat any questions or anything like that. So I know that she can hear, but we're also going to check the whisper test. So I'm going to clip this ear right here, and I'm going to repeat a word, or I'm going to say a word and have you repeat it back to me.
Baseball.
Okay, now we're going to do the other side.
Soccer.
Okay. And then next will be cranial nerves number 9, 10, and 12. So that's going to be your hypoglossal, your vagus, and your hypopharyngeal. Your glossopharyngeal, your vagus, and your hypoglossal. So I must have you stick out your tongue here, and then move it left, right, up, and down. I'm also going to check your gag reflex. So open your mouth, say ah. Okay. And the gag reflex was intact there. Sorry about that.
Okay.
And then next we'll also do cranial nerve number 11, which is the spinal accessory. So I'm going to have you shrug your shoulders. Thank you. Now we're going to move back to her eyes. So I already checked her sclera, and we're going to look in her eyes and open and close symmetrically. I want to check her lacrimal ducts to see if there's any tenderness here. Do you have any tenderness noted there? No. Okay. I'm also going to look into her eyes to see if I can see the red reflex. So I'm going to use my right hand, my right eye, and my patient's right eye. Cover her arm there, her eye there. And I can see the red reflex there. And now we're going to do the same with this side. And I can see the red reflex there. And we're also going to check her near vision. So I'm going to have you do the Rosenbaum here and then read this line right there.
IRRIGATE.
Okay, and that will be 20/20 there. And next we're going to do the cover uncover test to see if we see any strabismus. So go ahead and cover your left eye here and uncover it. And now go ahead and do your right, please. Great. So now that we're done with the eyes here, we're going to move on to the ears. Do you have any tenderness here?
Nope.
Okay. And we're going to look into her ears. Just got to switch this here to my otoscope. I can figure out how to work it. There we go. Okay. So I want to pull her kind of up and back to look into your ears at her tympanic membrane. And I can see it's a white and a pearly gray here. There's no redness or bulging of the tympanic membrane here. That's good. And same here. There is a little bit of earwax noted on this side. Okay. And then next we're going to check the RIN test, and I want to make sure that air conduction is greater than bone conduction. So I'm going to flip this tuning fork here and just tell me when you can no longer hear it, okay?
Okay.
Okay. Okay. And that would be air conduction was greater than bone conduction on this one, so let's try this other side. Okay. Okay, and that was a 2-to-1 ratio on that side as well. Now we're going to look into your nose. I'm going to check your patency, so if you will include one each side of your nostril and smelling, or try to sniff. There you go. There we go. So there is a little congested noted, but it's December in Oklahoma, so that's expected. I'm going to check and look inside her nose and look at her septum and her mucosa here. So make sure I have my light on. Okay. And look at inside her nose. The mucosa is pink. There's a little bit of clear discharge noted here, but her septum is midline and there's no deviation noted. Next, I'm going to look into her mouth. Open your mouth for me. Say, I'm going to look at her soft and her hard palate here. Her uvula is midline. There are no tonsils present. Go ahead and lift up your tongue for me. I don't see any ulcerations here. And I'm looking at all 32 teeth. They're intact with no dental caries noted. Alright. Next, I'm going to feel for her sinuses and palpate all of her lymph nodes here. So I'm going to palpate your maxillary sinuses here, your frontal, any pain, or look at some lymph nodes here, your preauricular, postauricular, occipital, submental, submandibular, tonsillar. We got your anterior cervical chain, your posterior cervical chain, your supraclavicular here, your infraclavicular, and your axillary. And I didn't notice any lymph node swelling there. And next I'm going to move to her neck. I'm going to go ahead and have her push her hands against my resistance. I know we already checked cranial nerve number 11, but I also want to check, make sure she is able to move her neck. And she's able to move it front, but she can move it back, and then side to side. Great. How about like this? That way. Good. All right. Next we're going to check her neck here. So her trachea is midline. I want to check her thyroid. You can go ahead and swallow for me. Thank you. We're going to check her carotid arteries, but only one at a time, so we don't include anything here. And now I'm going to listen to see if I hear any breeze. Okay, I did not hear any bruise, and I also didn't hear any stridor. So next we're going to move on to her her back. So I'm going to have you, if you don't mind, scoot up for me here. And she's able to stand and walk, so that tells me her cerebellum is intact here. So I'm first looking at her back here. The skin is intact. I'm not noticing any discolorations. I'm not seeing any retractions or anything noted. She doesn't appear to be in any distress. Excuse me. First, I'm going to palpate to feel for any crepitus or anything like that. And then I'm going to go ahead and do some tactile firmness. So go ahead and repeat 99 for me.
99, 99, 99.
Okay. And then next we're going to palpate for a diaphragmic excursion. So we're going to go from a resonance to dullness, and then from dullness to resonance, and it should be roughly around 3 to 5 centimeters. So go ahead and take a deep breath in and hold it for me. Okay, thank you. And now we're going to percuss up. And okay. There. And we'll look at the measurement here. And it's roughly about 3 centimeters. So now we're going to do the opposite side here. So go ahead and take a deep breath in and hold it. Okay. And pull out all your air there for me. Thank you. Now we're going to pulse up. Percuss up, excuse me. This is for, and that's about 3 centimeters as well. And next we're going to look at her thoracic expansion. So go ahead and take a deep breath in and out. Okay, that was good. And next we're going to percuss systematically here. We're also going to percuss the lateral side of her chest. And next we're going to do auscultation. So I'm going to have you take some deep breaths in and out for me, okay? Deep breath. No. 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 Lateral side here. And out. And out. Okay. And then I'm going to cuss to see if she has any CVA tenderness here. Any tenderness there?
No.
Any tenderness there?
No.
Great. So next we're going to move to the front of her chest. Thank you. Okay, again, I'm looking at her respiratory rate. She is not in any acute distress. There's not any retractions or any abdominal muscle use here. I want to palpate here for any tactile firmness, excuse me. So we're going to say 99 here.
99, 99, 99.
Okay, and then next we're gonna, well, I guess I'll do that again for me, so I can have the camera see me.
99.
Thank you. All right, and then we're gonna percuss again. Okay. All right, and then now we're gonna listen to her lungs. Deep breath in now. And the lateral side of chest again. Okay, great. And now we're going to listen to her heart. We're going to listen to the areas of the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. So the aortic's on the second costal space on the right side. I'm going to start there. And then the pulmonic on the left. Erb's point here at the third intercostal space. The fourth intercostal space is going to be the tricuspid. And the fifth is the mitral at the midclavicular line. Okay. Now I'm going to palpate for any heaves or thrills or anything in her chest, and I'm also going to locate the PMI. So can you go ahead and lean forward for me as well? Thank you. And then I can also check this with her laying in the left lateral position. And so next we're going to go ahead and move on to the abdomen. So if you don't mind, go ahead and lay back for me. And we're going to move the bed up a little bit. Alrighty. So now we have her roughly at a 45-degree angle, and I don't see any JVD or anything like that noted here. So I'm going to get on the right side of the patient, and I'm going to look at her belly here. I don't see any noticeable fluid motion, no abdominal muscle retractions or anything like that. Can you go ahead and lean forward for me, and I'm going to check your muscle mass? Great. Okay, and so next I'm going to auscultate in all 4 quadrants, and then I'm also going to auscultate her arteries. We got her aorta here, her renal arteries, her iliac arteries, and her femoral arteries. Alrighty, and our bound sounds were normal, active, and I did not hear any thrills or anything like that. So next we're going to go ahead and do some percussion. I'm going to percuss her liver span here. I'm going to go grab my marker and my tape measure here. And so we're going to percuss down, start at the liver and percuss up for tympany to dullness, and then down from resonance to dullness. And it should be roughly 6 to 12 centimeters. I think we're right about 7 there. Alrighty, and then I'm going to do some light palpation in all 4 quadrants. Any tenderness or anything there? I'm going to do some deep palpation. Any tenderness there? Okay. Now I'm going to percuss for the liver, palpate for the liver and the aorta there. The spleen. And then your kidneys here. And now I want to see if there's any tenderness in her hips, any legs, knees. I don't see any swelling in her legs or anything like that. Her hair is evenly distributed. Her temperature is warm and dry. I'm going to check her pulses here. So we got her popliteal. Okay. Posterior tibial. And her dorsalis pedis. Okay, I'm going to check her muscle strengths here. So I'm going to have you push against me, pull up. Okay. Also going to check her hips here. So push, pull, and same with the other side. Okay, push and pull. Okay, if you don't mind sitting up here, I'm going to check some reflexes. First, I'm going to check your brachial here. Okay, now I'm going to check her patellar here. Okay, your Achilles. Right. I'm going to see, check your arms here. Can you go ahead and squeeze my fingers, push me towards you, pull me away. Great. Then I'm going to check her brachial and radial pulses. And make sure her cap refill is good. You're fine. And this concludes my assessment of my head to toe video of Randy Appleman. Thank you for participating and thank you for watching.